Well, we've been a client of i2i for since 2003, so 13 years now, around the time that we adopted our first EMR. And the senior management at our organization, I think, have been kind of at the front of the curve when it comes to health IT. We were certainly one of the leaders and at the forefront of adopting an EMR, and I think that they recognize that managing patient populations through electronic medical records and the data that can be mined is something that was going to be a wave of the future. How we've used i2i has evolved over my 8 years with our organization. Initially, when I first started, we were tracking pap smear results, recalls on patients who hadn't been seen for a pap smear, mammograms, and a few other smaller reporting functions, UDS reports, for example. Over the last 8 years, we've dramatically expanded how we use i2i. We use the huddle sheets every day, all providers, all 5 health centers. We track referrals and make sure we close the referral loop. Of course, we run reports now we're an ACO, so we have an ACO report that we run, of course the UDS reports, and we've just really expanded all the different ways and uses that we use i2i. The benefits we receive from Trax is we notice every month we have a performance improvement team, and every month we run reports using HEDIS measures and also UDS measures that give us data on how the providers are doing, and also more macro level with each health center. And we can see from month to month, year over year, that our rates increase. Our rates of screening, of tracking referrals and making sure that patients actually had that mammogram, had the colonoscopy done. We're able to send out recall letters if we don't have a report and get the patients back in. You have to use the reports and the data in order to look for the care gaps and to improve your outcomes. Working together as a team, we use the huddle sheets extensively every day. I find those personally to be very useful. It's very easy at a glance to see what care gaps there are for a given patient at the visit. We have an actual true huddle where we sit down with the MA and go over what each patient needs and sort of pre-plan the visit, and it really makes it a lot easier than searching through your EMR in various locations looking for the last mammogram and the pap smear and have they had their flu vaccine, have they had Pneumovax. All of that information is right there in a very easy to read format. Well, as a FQHC, we're involved with something called the Health Federation of Philadelphia. And so it's kind of taking the macro level to a even larger macro level, where this is a federation of 10 separate FQHCs, some smaller and some larger than others, approximately 200,000 patients, and we're aggregating the data using PopIQ. And the Health Federation looks at each health center and says, okay, you guys have very good outcomes, but this one doesn't. And what are your best practices, and how can this other health center learn from that, even though they're not within the same organization? So like I said, it's taking a macro to an even larger macro level.